The soul would have no rainbow if the eyes had no tears. Chondral and osteochondral knee lesions are frequently linked with the progression of osteoarthritis, yet most knee repair studies traditionally exclude patients with mild to moderate osteoarthritis. This study sought to compare clinical and safety outcomes of an Aragonite-based osteochondral implant against surgical standard of care, SSOC, specifically in patients who also had concurrent mild to moderate osteoarthritis. This randomized controlled trial included 251 adult patients aged 21 to 75 years across 26 centers globally with specified cartilage defects. These patients were randomized in a 2:1 ratio to receive either the Aragonite-based implant or SSOC, consisting of either arthroscopic debridement or microfracture, with a follow-up period of 5 years. The primary measure was improvement in the knee injury and osteoarthritis outcome score, with additional evaluation on responder rates and adverse events.
Quick take. This study compared the long-term outcomes of an Aragonite-based implant with standard surgical care for knee lesions, tracking improvement over a 5-year period.
The implant group showed a significant improvement in the overall CUS score compared to the SSOC group, with a mean difference of 22.6 points. Additionally, the responder rate for the implant was substantially higher than that for SSOC. The rate of treatment failure was also significantly lower with the implant. Among patients with mild to moderate osteoarthritis, the implant showcased better outcomes with a higher responder rate and lower failure risk than SSOC. The authors conclude that the Aragonite-based scaffold demonstrated significant clinical efficacy and safety, showing superiority over SSOC at a 5-year follow-up.
Quick take. After 5 years, the Aragonite-based scaffold provided superior clinical outcomes and safety compared to standard surgical care for knee lesions.
Short quiz, clinical vignette. Question. A 60-year-old male patient with documented mild osteoarthritis presents with knee pain and is found to have International Cartilage Regeneration and Joint Preservation Society Grade 3A cartilage defects. Based on recent trial data, which treatment would most likely result in superior clinical outcomes? Option 1, Aragonite-based implant. Option 2, surgical standard of care arthroscopic debridement. Option 3, surgical standard of care microfracture. Option 4, conservative management with physical therapy.
The answer is option 1. The trial demonstrated that patients receiving the Aragonite-based implant had significantly better outcomes, including improved COS scores and a reduced failure rate compared to those who received standard surgical treatments, particularly in those with mild to moderate osteoarthritis.